So have you ever noticed how we typically will see knee valgus occur during a squat right around that 90-degree mark? Well, have you ever wondered why that happens? So we tend to blame weak muscles, and what I really want you to walk away from this video with is a better understanding as to the three main reasons why we see that, and hopefully to stop blaming muscle weakness. Now, before we get into the three main reasons that we see knee valgus, we need to first review and go over the lower extremity arc of motion. That is the 0 to 120 hip flexion range, where we should see an ER, IR, ER correspondence. So as a refresher, from about 0 to 60 we see ER strategies. From 60 to 90 we see IR strategies. And from 90 to 120 we then see ER strategies again. And again, the main reason for that IR shift in the middle is because of the reorientation of the pelvis muscles as the hip gets into greater ranges of hip flexion. So once you understand that, you can understand what we should see and what is normal versus abnormal. So if we're talking specifically around the 90-degree mark, we should see a slight IR bias. So with that being said, let's jump into the first main compensation. The first main compensation that we see knee valgus is because the patient or client is trying to pick up IR-based strategies. Now wait a second, I just said you need an IR at 90. Well, remember, these IR strategies are relative motions, meaning they're small, right? Meaning as we're going into hip flexion, we should be moving into small amounts of internal rotation. The problem is if we don't have the ability to do that because of poor posture, an easy way to produce a nominate internal rotation is to take that femur and throw it into that valgus IR position. So we essentially take the femur and try to use it as a means to improve our IR-based strategies here. So it's essentially a false sense of IR. When we go down into that squat, ideally the knees should be able to maintain their normal range of motion. They shouldn't be blasted into external rotation. They shouldn't be blasted into internal rotation. The pelvis needs to go through this range of motion. And if that's hard to understand, think about how your shoulder blade or your scapula moves with your humerus, right? When you move your arm, we expect the shoulder blade to move in the associated upward rotation as we get into more humeral flexion. Same thing happens with the femur. The greater we go into femoral flexion, the more we start to see different mechanisms happen here. So what they'll do is they'll find their IR strategies through their femur. It's not true from the pelvis. We have weakness and a lot of poor patterns that are then demonstrated at the pelvis, and then we have knee pain, right? So yes, weight can be a big contributing factor to this. Too much weight, you'll see that increase knee valgus, but the main reason why is because IR produces power. So they're trying to find that power output. The second strategy as to why we see knee valgus occur is because of an anterior pelvic tilt. So we're thinking about postures here, right? So with an anterior pelvic tilt, we need to understand what's going on biomechanically here, right? And then we also need to bring it back to look at the specific snapshot in time that we are looking at the squat. So we already said that's around 90 degrees and we should see an IR bias, right? Well, with an anterior pelvic tilt, we tend to see a nutated sacrum, so a forwardly tipped sacrum, and nominate bones that move into IR, internal rotation, adduction, and extension. Well, wait a second. We need IR on 90. This is what we should have. Correct, this is what we should have. We should have a relative bias toward this position. The problem is, if someone is stuck in that massive anterior pelvic tilt, if you can think about the piriformis muscle and the external rotators being from this anterior aspect of the sacrum down to the greater trochanter, they're going to be in an extremely lengthened position because when you tip this forward, you are eccentrically orienting these muscles. Now, when we get to that 90-degree mark, they need to be a little bit more on that concentric side. So if we are starting out too eccentric, then it won't give us that concentric ability. And these individuals will then try to find it through their femur. So again, too much eccentric orientation of our external rotators doesn't allow that concentric activity. So as a result, an easy way for the human body to do it is to move that femur into internal rotation, giving you that knee valgus around that 90-degree mark. The third and final strategy as to why we see knee valgus occur right around that 90-degree mark is because of a posterior pelvic tilt or a sway back posture. So this is the exact opposite as the second point, right? We talked about an anterior pelvic tilt. Well, what's going on biomechanically at the posterior pelvic tilt? Well, just the opposite. So we're going to see counternutation occur at the sacrum. Counternutation is when the sacrum tips back. We then see relative motions of external rotation, abduction, and flexion occur. So here's the thing. If we go back to our specific point of that 90-degree snapshot, we know that we should have an IR bias. But what I'm saying here is this posture produces an ER bias. So there's already a disconnect, right? So when we're in that ER bias, the external rotators are going to be concentrically oriented. So it's just the opposite as the anterior. This concentric activity of external rotation makes them stay there, and it doesn't give them that eccentric ability to lengthen. So these types of people need more eccentric activity, whereas our anterior pelvic tilt needed more concentric activity, right? So when they get down to that 90-degree mark, they are so compressed that they don't have the ability to reorient towards more of nutation and towards more internal rotation because they've been stuck from the beginning, right? Because if you think about the lower extremity arc of motion, our sandwiched position, the two ends are ER. So they're really good at that. But the problem is they don't have enough eccentric length to then move into that more IR bias at that 90-degree mark. So those are the three main reasons as to why we will see that knee valgus occur right around that 90-degree of a squat. And the big takeaway here is that you need to understand what's normal versus abnormal during certain parts of your lift, and then if something's not happening, why is that not happening, right? So for our IR-based strategies, maybe we need to decrease the amount of weight that they're doing, but we also need to respect the starting posture or position that they're in. For our anterior pelvic tilt individuals, they're going to need more compressive-based strategies, more posterior pelvic tilt-based exercises. And then our posterior pelvic tilt postures or our sway backs, they're going to need more expansion. Think split stance deadlifts, right? They need to eccentrically orient so they can hit that IR strategy right around that 90-degree mark.